tonsillitis. So tonsillitis is the infection of the palatine tonsils, right? Which is caused by either virus or bacteria. From virus, there's influenza virus, common cold virus, adenovirus, or Epstein-Barr virus, right? From bacteria, there is beta hemolytic streptococcus bacteria mainly, right? Then differential diagnosis of tonsillitis are pharyngeal diphtheria, quinsy, and parapharyngeal abscess, right? Now, patient will come with a chief complaint of a fever, sore throat, dysphagia, that is a difficulty swallowing, generalized body aches, and referred earache, right? On examination, I will check vitals of the patient, that is blood pressure, pulse rate, it will be increased, respiratory rate will be high, temperature will be rising, right? Then I will do oral cavity examination, that is inflamed tonsils plus reddish and congested tonsils, right? I might also see pus and crepes in case of follicular tonsillitis, right? Now let's come to different clinical forms of tonsillitis. So the first one is superficial tonsillitis, which is limited to the surface of the palatine tonsils only, and it is basically associated with pharyngitis, right? Then comes acute follicular tonsillitis. So it involves the infection spread into the tonsils from the mucous membrane. Earlier in superficial tonsillitis, there was only mucus involvement, but in this case, infection is spread into tonsils also from the mucous membrane, right? And crypts are filled with pus in this case, right? Then comes acute parenchymatous tonsillitis. So it is a severe acute inflammation involving the entire tonsils, right? Uh, Jugular diagnostic lymph nodes are also palpable in acute parenchymatous tonsillitis. Basically, the parenchyma of the tonsil is involved in this case, right? Now, the last one, acute membranous tonsillitis, right? So it is severe and advanced stage, and there is grayish membrane which are present over the tonsils. But remember that in pharyngeal diphtheria, there is also grayish membrane which are present over the tonsils. So we will rule out diphtheria first, because diphtheria is quite lethal and acute membranous tonsillitis is manageable quite easily, right? So to rule out diphtheria from acute membranous tonsillitis, we will compare the membrane, bleeding, systemic features, and throat swab results, right? Like as for the membrane is concerned, so in acute membranous tonsillitis, there is white yellow membrane which is less adherent, while in case of diphtheria, there are gray white thick and tough pseudomembrane, right? So far the removal is concerned, so acute membranous tonsillitis is may separate easily, while the diphtheria, it generally bleeds on removal, right? Now let's discuss the management of tonsillitis in adults. Remember, the management of tonsillitis and pharyngitis is the same. So I will discuss the management of pediatric patient in the pharyngitis portion. You guys can see it from there, right? Because as both the management is same. So first of all, I will give antibiotics, that is amoxil. I can give augmentin 625 milligram, TDS, Azomax, which is basically azithromycin 500 milligram OD, Cefigate, or Caricef, which is basically cefixime. It is safe in pregnancy also. It is 400 milligram OD. I can also write Claricid, which is basically clarithromycin 250 milligram BD, right? Now, from NSAIDs, I can give Brufen 400 milligram BD, and Panadol, which is safe in pregnancy, 500 milligram, 2 plus 2 plus 2, 3 times a day, right? Then I will write antihistamines. So from antihistamine, I can write Fixate 600 milligram OD, which is basically fixofenadine. I can write Tab Regix 10 milligram OD, which is cetirizine hydrochloride. I can also write Jardin, tape Jardin 10 milligram OD, which is loratadine, right? Then I can prescribe steroid gargle to the patient, that is 2 tab of betnisol in half glass of water 3 times a day, right? It basically shrinkens the tonsils.